much. Yeah, welcome to this pleasant evening. I'm Nakul Patil, Senior Product Manager at Emcure Inventia Division. OroferFCM is our core brand and it's an epitome of quality and success. We are really thankful to IFS Tamil Nadu with VOGS and Trinamalai Society for giving us opportunity to host this scientific webinar and be a partner for this wonderful academic educational initiative. Now, may I take the opportunity and introduce today's expert and IFS Tamil Nadu Secretary, Dr. Rajpriya Appan, Priya Kanan, and definitely Dr. Abdul Basid. He is an executive member. I'm just sharing his CV. I hope it's visible to all.
Yeah, it is.
Yeah. Dr. Abdul Basid, he has did his MD. He is a consultant at Cloud9 Hospital, T Nagar, Chennai. He did his diploma in gynecology endoscopy 2013 at Delhi. He's a member of Royal College of Obstetrics and Gynecologists in UK. He 2 years post-doctoral fellowship he has taken in reproductive medicines. And most important, that's he's almost invited as a faculty to state conferences and many international conferences. Welcome, Dr. Abdul Basid, and over to you, Doctor.
Thank you, Mr. Nakul. So good evening, everyone. I take immense pleasure in inviting our faculty and delegates this evening to one of our special series of webinars, Get Legally Empowered. This time, IFS has partnered with Vellore and Tiruvannamalai OG Society, and we have a lot of practicing clinicians here to voice their practical dilemmas and arrive at a proper consensus, medically and more importantly, legally. So I now invite our guests to preside over the webinar. From Tiruvannamalai Society, we have Dr. Radha Madhavi. Can I have her CV, please? Madan?
Yes,
yes, sir.
Can you repeat, please?
Dr. Radha Madhavi, President of Tiruvannamalai Society.
Otherwise, let it come in the order. Whichever order comes, you can introduce them, Abdul, because all four of them you are going to invite, right?
Yeah. We have Dr. Alamilu, who's the Secretary of Tiruvannamalai Society.
Yeah.
Dr. Radha Madhavi, she's the President, Founder President of Tiruvannamalai OG Society, also the Director of Rajam Multispeciality Hospital and Director of Rajam Institute of Paramedical Sciences. She has done her MD from Air Force and DNB from National Board, New Delhi. She is presented of papers at AICOG. She's practicing from 94 till date, conducted 3 annual conferences. Welcome, madam. We invite you to preside over the webinar. Next, can I have Dr. Alamelu's CV? She's the Secretary of Tiruvannamalai Society. And I also welcome Dr. Manisha, who's the President of Vellore OG Society, and Dr. Swati, who's the Secretary of Vellore OG Society. Dr. Alamelu, she's a consultant at Jaya Hospital and Founder Secretary of Tiruvannamalai OG Society. Next, can I have Dr. Manisha's CV, please? Dr. Manisha is the Professor and Head Fetal Medicine Unit of Christian Medical College, Vellore. She did her MBBS from Lady Hardinge and MD from University College of Medical Sciences, New Delhi. She's been trained in fetal medicine from New Zealand. She's been the President of Vellore OG Society from 21 to 23, member of National Committee on Genetics and Fetal Medicine, awarded Bill and Melinda Gates Foundation Travel Agent for presenting travel grant for presenting research on GBS infections in pregnancy at Cape Town, South Africa. She is a peer reviewer for many journals and presented a lot of papers in national and international journals. Next, I invite Dr. Swati, who's the secretary of Vellore OG Society. Can I have her CV, please? She's a professor of the Department of OG at Christian Medical College and Hospital. She's done her senior registrarship between 2002 and 2004 from Safdarjung and did her observership in fetal medicine unit at New Zealand. And she's had a lot of papers in national and international journals. I invite all of these doctors to preside over the webinar today. So without further ado, we go on to the first part of our webinar where Dr. Rajapriya Ayyappan will share her wisdom and take on how ART Act 2022 has impacted our infertility practice. Can I have Madam CV, please? So Dr. Rajapriya is a managing director of Srinivas Priya Hospital, Perambur. She's an executive committee member from 2021 until now in OPSI, ATN RCOG, FPSI, FOXI. She's an endometriosis committee member, secretary of Perambur IMA Women's Wing, and she's been the secretary for Indian Fertility Society from the time that I've known Indian Fertility Society. So over to you, ma'am. I hope that we will have a mind-opening session.
Thank you, Abdul. It was a nice word saying that I've been secretary too long, right? So even I feel like, okay, I can't wait to hand over the baton to the next person, but wait until next year. Okay. Okay, is the slide seen?
Yes, ma'am.
Yeah, fine. So good afternoon to each and every one of you who have logged in for this Legally Empowered series. I'm very happy that we have Vellore Society and Tiruvannamalai OG Society who have joined us along with IFS Tamil Nadu. And this particular series, we take an opportunity to reach out to all gynecologists in regular practice to get an update on the ART law, which deals with the new practice of infertility. So in the next 15 to 20 minutes, I would just go through the various update points which all of us need to be aware. This is a law which has immensely changed today's practice. I'm going to change the next slide. Okay, sorry. Yeah. Now, India is one country hugely populated, and we never thought that we would need a law to regulate the assisted reproductive techniques, but definitely with any evolving technology going leaps and bounds, there needs to be a check, and that's where the law has come in place. Now, the history is until now, a man can give multiple times his semen for donation. All that was needed is just some medical information and a particular, even ordinary ART clinics could collect the semen and do the process, and multiple pregnancies were allowed from a single donor, and any age couple could go in, even if the couple is 60 years, to seek IVF, and so too the oocyte donor. Multiple times they could donate, and banks could advertise, and financial compensation was being given to donors. Now, this is history. This can no longer happen. Initially, accreditation was a matter of self-accreditation, either through Indian Council of Medical Research or the PCPNDT Act, or societies like Indian Fertility Society or the Indian Society of Assisted Reproduction like ISAR. It is only after the law came in, the single valid registration is only the registration by this national registry. All other registrations stand null and void as of today. Now, ART 2010, I'm talking way back, already brought in some recommendations through ICMR. What are the minimum requirements for somebody to set up an ART center? What is the infrastructure? What about staff and qualifications? What about which procedures they can do, for which facilities and equipment necessary? What kind of patient information and selection criteria? What about consent forms, record keeping? And subsequently, ICMR was also planning accreditation and inspection and planning renewal as well. Now, with respect to infrastructure, if you have decided to get into the practice of ART, you need to have a non-sterile area, a reception and waiting room for patients, a room for privacy to examine patients, a proper laboratory, storage room, records room, autoclave room, vermin proofing, and a dedicated semen collection room, not just a toilet where they can go and collect the semen. So this is roughly an outlay of the various specified requirements. With respect to the proper ART lab, semen processing laboratory, a clean room for insemination, an operation theatre where egg collection can be done, a room for embryo transfer, the embryology laboratory complex, ancillary lab facilities which are capable of doing microbiology, endocrinology, histopathology, a proper annual maintenance of all these laboratories as per dictum, quality of consumable used, backup power supply, and a proper list of equipment. Similarly, for staff, the gynecologist, the andrologist, the embryologist, the anesthetist, counselors, IVF nurses, the director or the program coordinator, for all of them, qualifications were specified. So this is very, very important. With respect to staff requirements, advanced with respect to reproduction, we need andro technician, junior embryologist, senior embryologist, embryologist assistants. For each one of them, the degree, the experience is important. With respect to skill, because until today, we did not have dedicated embryologists. A lot of them were only having less degrees, but more skill and knowledge. And any day, skill and knowledge surpasses the degrees. But with the new law, it is the degree which is surpassing the skill. And what are the various procedures these ART registered clinics offer? Insemination with husband, insemination with donor semen, embryo transfer, frozen sperms, and followed by transfer, oocyte donation, embryo donation. Now, according to the new ART law, embryo donation is no longer possible. Cryopreservation. It is a technique where the embryos, eggs, and sperms stand frozen for a use at a future date. Pre-implantation genetic diagnosis, or PGD, which gives an opportunity to select a healthy embryo and transfer only the healthy embryo. And surrogacy, that's a huge topic by itself. Now, the ART bill was first passed in 2021, December 1st. After the Lok Sabha, it was then sent to the Rajya Sabha where it was passed. And subsequently, in December 2021, it came to publication in the Gazette, and it started getting enforced from January 25th, 2022, both the ART law and the surrogacy law. Once the publication happens in the Gazette, it is a rule which all of us gynecologists and those keenly interested in the practice of infertility should follow. Now let's look at how the law works. The law is segregating as level 1 and level 2 ART clinics. The level 1 ART clinic have to pay a registration fees of 50,000 and apply for facilities with respect to insemination either by the husband semen or the donor semen. Without a registration, no gynecologist can practice insemination. Obviously, when you're registering, as we rightly said, the infrastructure, the staffing, the facilities and equipment also should be owned by the person who's registering. Because at the time of inspection, all this will be inspected right from the transvaginal sonography where you need to be registered with the PCPNDT. Now, with respect to the level 2 ART clinic, the fees is 2 lakhs to register, and all advanced form of assisted reproduction is done here, including handling any gametes. So when you're handling gametes, it is important for us to register. If you're handling semen, it is level 1. If it is handling the eggs or the embryos, then it becomes a level 2 clinic, wherein all diagnostic and therapeutic facilities are offered. Now, according to the new law, every ART clinic and bank must be registered and the National Registry of India. The state government will appoint registration authorities who will come and inspect and do the registration process. And we have to adhere to the standards given for manpower, infrastructure, and diagnostic facilities. Each time we do a registration, it is valid for 5 years. And at the end of 5 years, we have to renew. And each renewal is for 5 years. If we are not adhering to the standards, our license is subject to cancellation or suspension. Now, there is an appropriate appropriate authority, which consists of a chairperson, vice chairperson, an eminent person from a women's organization, a representative of the law department, and an eminent registered medical practitioner. All these are licensed to come and inspect our area, see if the requirements are met. Then they grant the registrations. They also have the rights to suspend or cancel the registration. They also have the right to take a legal action whenever a complaint has come against the particular ART center. Now, what does the National Registry do? They have a complete database of all the ART clinics spread through the length and breadth of the country, along with the ART banks. So it is important that unless you are registered, you cannot. So it's a central database. Now, once the National Registry and the appropriate authority have come in, we have to understand the MRD, the records department becomes very important. Like how for the PCP entity, every month by the 5th, we submit a report. Similarly, we have to submit a report of how many patients we offered IUI treatment or ICSI treatment by the 5th of every month. Now, obviously, we as doctors depend a lot on our nurses and other staff to do this work. It is important that we start enlightening our junior staff that all documentation, all records are kept in order. Now, until now, even a 50+ woman was offered treatment, but with this law, the woman's age limit, she has to be at least 21 years of age. You cannot give for a woman who's less than 20 and not more than 50 years of age, according to the Aadhaar proof. Similarly, for the man, 21 to 55 years of age. Now, when they come for inspection, the records, the consent forms, the discharge summaries, relevant photos of even the ultrasound follicle tract pictures, all this have to be kept with us. And the National Registry also will have to be reported. The monthly reports, all this have to be kept in the storage. You have to be ready for a 24/7 inspection by the national and the state board. So what is seen as an offense? When a law comes, the purpose of the law is to check if we are offending the law. What are the offenses? Whether the children born out of ART treatment were abandoned or exploited, because all this was happening in the past. Whether any selling of gametes or embryos trading is happening. Whether any couple, woman or a donor is getting exploited. And whether the human embryo is getting transferred into a male or an animal as an experimental procedure. Anything was happening for research without license, and whether commercial intermediates were used for purchasing donors. Now, let's have a caution. Until now, multiple embryo transfer and fetal reduction was happening rampantly. Now, there is a limit. Not more than 3 embryos can be placed in a womb at a given time. In fact, today we are shifting towards a single embryo transfer. We as ART clinicians also understand it is easier for the uterus to bear a single fetus, and it is easier for a family to handle a single child at a given time. So we ourselves have moved towards the single embryo transfer. Now, in a given cycle, we cannot use more than a single man or a single woman's gametes. Now, initially there was mixing of gametes, sharing of gametes. All this is no longer allowed by the law. Now, same with the pre-implantation genetic diagnosis. It cannot be used for the purpose of sex selection. It can only be used to select a healthy embryo in case of a hereditary disease or suspected aneuploidy. Now, what about penalty? When there is a law, when there is offense, so comes penalty. The penalty can be fine, imprisonment, or closure of the clinic, and even cancellation of the license. Imprisonment can range from 5 to 10 years, and a fine can range from 10 to 25 lakhs or more. Now, let's focus more on the level 1 ART clinic, which offers insemination services. Anything dealing with semen falls under the level 1 clinic. So if someone is wanting to continue the practice of insemination, they have to register, pay the fees, have the following requirements: the reception room, waiting room, consultation room, records room, backup power supply, fire safety license, Clinical Establishment Act license, laboratory services which are accredited, requirement for IUI room, semen collection room, autoclave room, semen processing lab, and the requirements for semen processing. The particular clinic needs a counselor also, because the counselor has to understand that whenever a treatment is given, the treatment doesn't give a 100% guarantee. So the counseling of the success of the treatment whether the couple are in stable relationship, whether they're going through psychological stress or anxiety. When they are taking in for donor insemination, are they clear what they are going in for? Sometimes they also, adoption has to be counseled. So these are all important requirements. An andrology technician, because that's the person which is mainly going to deal with semen analysis, semen processing, maintenance of the IUI lab, records keeping in the IUI lab. And whenever a donor semen is taken from an ART bank, all the requisite papers have to be filed and kept in order. So as we already said, it is essential for the National Registry to know why this couple were offered treatment, what is the indication, how was the procedure done, what was the outcome, whether it's a positive result or a negative result, whether any complications like hyperstimulation of the ovary or any complications occurred. And all these records have to be kept in order, and any IUI summary, etc., has to be kept for 10 years from the date of completion of the procedure. In case there is a change in the employee or the equipment, all this has to be informed to the appropriate authority. No mix-up of gametes. A lot of times our patients give a request, my husband's sperms are weak, but I don't want my husband to know that I'm going through a donor semen, doctor. So can you mix a little with strong sperms? I think we as gynecologists, by trying to help a patient, shouldn't put our own selves in the wrong eye of the law. We can't get into trouble with the law anymore. Whenever there is a clinic offering more than 3 or 4 patients donor IUI at the same time, meticulous labeling so that they don't get into the feeling that a mix-up of sperms has occurred. So identity of this should be mentioned in the tubes, dishes, and pipettes. A logbook has to be maintained. We have to make sure that the calibration of the instruments of whatever we're using, whether it's the centrifuge or the lamina airflow, all this has to be calibrated, and we have to have a record of the calibration. And wherein we store the media, the refrigerator temperature record has to be maintained. We need to have a backup power supply. And we do live in an era where patients have a lot of expectations and they want this kind of a person's fair complexion, this blood group. So as far as the physical characteristics are there, definitely we can comply with the patient's request and tell the ART bank that I would suggest that you give these kind of physical requirements. But the expectation of the patient might even be for on a high IQ, etc., and certain things where we are not in control. The ART bank, similarly, the bank which gives a donor semen sample, we have to ensure that whenever we get a semen, we have to have a record from them saying that this is a screened sample, all the physical characters mentioned, a consent has to be mentioned that the donor has agreed to donate his semen, and the donor can donate only once. So we have to make sure that it is from a registered donor bank. What are the requirements for the donor? He has to be between 21 to 55 years age only. And if it is a woman, it should be between 23 to 35 years age only. And we do know that as a woman crosses 35 years of age, her egg quality can come down, so to her egg quantity. The bank cannot supply the gamete of a single donor to more than one commissioning couple. So again, online, if you see the general requirements for the level 1 clinic, the laboratory services, the sterile area, all this is there. And there is even standard consent forms. If you're using the husband's semen, the standard consent forms are there. And we have to get the consent forms as per the law and make sure that the signature of the husband, wife, and the doctor is put there with the proper date. So with this, I would like to close the presentation on running a level 1 ART clinic. Way back in 1978 itself, we know that UK was able to bring about the Regulation Act, and there stands Louisa Brown with her kid. However, in India, it took a long time for us to evolve and bring the act. Although in the same year, 1978, we did have Dr. Subhash Mukhopadhyay who released our own Indian baby, Durga. But at least by 2022, we have managed what UK managed with the HFEA in 1991. So I would just thank you all for your time. And it's a humble appeal that we have to know the law and we have to understand the law, that we may be doing insemination, but just let's follow these regulations. It's just to make life better for us and for the patients. So thank you so much for your time. I'll be very happy to answer any questions if you have so.
I request Dr. Radha, Dr. Alamelu.
Radha ma'am has joined in?
Yeah, she's joined. Welcome, Dr.
Madam,
Radha.
good afternoon. Madam, good afternoon.
Afternoon,
At the outset, I would like to thank IFS and our colleague society, Vellore Society. Am I audible, madam?
yes, ma'am. Yes, ma'am.
Sir, am I audible, Abdul sir?
Yes, you are very much audible, madam. She's disconnected, I think. Dr. Manisha, Dr. Alamilo, if you want to ask any questions or have, give us your inputs about.
But I think at CMC Vellore, they have one of the best ART setups possible. So Manisha ma'am will say, sir is out there to take care, right, Manisha ma'am?
Yeah, but it's an eye opener for us. Of course, they're doing a good job, but we, as a fetal medicine specialist, especially, what we face is the ART centers around us. They will put like 6 embryos and 5 embryos and promptly refer to us for fetal reductions. So this is it's almost reached up to epidemic proportions. Every other day we are getting quintuplets and sextuplets and saying, okay, go to CMC. They will anyways do fetal reduction. So it's good to know that there is now a law which says no more than 3 embryos, but unfortunately, I don't think it is still being practiced, at least in the
But you now have a right to complain, ma'am.
Yeah.
Legally, you are bound to complain because the law has come.
Yeah. So thank you for making me aware of that aspect. Actually, I was actually wanting to know about it. So a lot of things I learned. Again, the age of the parents is so very important. Recently it was that couple was in news when they were 70 years and they had a baby. And then unfortunately, 1 year later, that man passed away. So all these things are so very important. And it's really nice to know that finally some form of regulatory things are being put into place as with respect to ART.
I think
I'm sure we still have a long way to
there, ma'am. But whether the law abiding part is the challenge. And very clearly, whatever be the law, unless the authority is aware that a breach of the law is happening, they will not be able to take action, ma'am. Because how will they? They can't keep scrutinizing. ART centers are mushroomed all around us. How would they know what is happening where? Unless that is why there is a grievance cell today. See, if a particular woman is feeling that she went through some discomfort, she was not informed, she's got 6 embryos inside her, she's now going for fetal reduction, she's traumatized or she lost all the embryos under the procedure. There is a grievance cell which is supposed to take care of this particular problem and find out what went wrong, or otherwise their ART center is liable for an inquiry as to why such a situation happened. Because I'm surprised to know that you're still facing situations of fetal reduction.
Yes, I'm talking about 5 days back.
My goodness. Vivek, what do you say for that? Medico-legal expert?
But it takes time for people to realize that what they should do and what they shouldn't do. It's happening in Chennai itself. So I won't be surprised about Vellore. It's happening in Chennai and it takes time. In fact, even registration itself hasn't taken place much. The authorities haven't even come to inspect any of the papers.
If they inspect, do you understand? How will they know a particular patient had 6 embryos in?
Yeah,
unless
it goes to the court, things will change. The courts have to take up the matter.
If you want to report to your local, the DMS office is the persons who come in for inspection. Am I right, Dr. Vivek?
But nobody will take action unless they are called up by the court. It's the court which is going to take action. They're going to call the authorities to look into the law and
actually the whole idea of inform the appropriate authorities. There's a legal person in it. So if you bring it to the notice, they will have to, according to the new law.
Yeah, but nobody's going to bring it to the notice. That is the thing. See, there are so much irregularities that are still going on, and nobody's bringing up to the notice of the authorities.
Manisha, man, if you think you really want to do some good, or if you don't mind taking the initiative, you can definitely bring it to the notice of your DMS office that after the ART law also, that more than 3 embryos are being placed. I mean, you don't have to put upfront a complaint saying like you don't want to put a particular center in trouble, but at least you can kind of sensitize the whole idea of the act is it has to be brought to their notice. Otherwise, they will not be able to.
It will take time, Rashmi. It's not going to just change. It will change. You have to wait.
To do
Yeah, so-
fetal reduction, I'm sure Manisha ma'am's heart will pain, no, like unnecessarily you're killing healthy embryos. That's not a pleasant experience for you either.
And some of these women are like high risk pregnancies. You have patients
Yeah,
with rheumatic heart disease and all who can't withstand the physiology of a normal one singleton pregnancy. Just imagine the trauma of having to have triplets and quadruplets, and then you're going on reducing. So even the medical thing is not stopping them from doing things like that, and so that is one thing. Of course, as you said, I was not very aware of what channel to go through. We took it up with them one-on-one, saying, see, this is what we are seeing. I don't think this is ethical. That is what we one-on-one we did, but I think now they stopped sending us and now they're directly sending to Mediscan. I think that's what happening. So now
So
of late,
That's
for
what
the,
it is.
Yeah.
Right.
It is for the courts to act. I'm telling you, it will act. It's a matter of time. The matter will come up to the court and they will call up the authorities to answer. That's what happened with PCPNDT Act. Nobody was following the law. And then the court took up the matter seriously and ensured the authorities go seal up some centers. That comes into the media and things will change.
See,
Unless,
in this case, media doesn't even have to come into the purview, no, Dr. Vivek. If Dr.
No,
Manisha
but
is able to tell the DMS
is-
office or the thing, then they can go and check the centers. Or
it is not so easy. It is not so easy. It's easy
And
for
you
us to
look
talk, but things
patient
don't
side.
happen that
Most
way.
patients want to get pregnant one way or the other. I'm sure that woman won't mind fetal reduction or rheumatic heart disease. She will want the baby end of the day. That's the reality. They will be ready to go through any risk to their life. They would have signed every paper possible saying, I'm ready for the risk. I'm sure the particular center would have taken all those precautions, right?
No, but the thing is that not a lot of women are told that if you do a procedure like fetal reduction, you could lose your entire pregnancy. So
yeah.
they are totally unaware. So what they are told is the more we put, the better your chances of
Yes.
success.
Chances are,
This
yeah,
is what I
absolutely.
understand from my
Yes.
talking to these people. But
Okay.
nobody is ever informed that there is a chance, there's a small chance, but there is a definite chance you will lose the entire pregnancy. So when we start talking to them along those lines, invariably they get upset. They say, why we were not told this before? We were told our chances of success is higher when you are putting in more embryo. So that is something. So the counseling that is happening is not, totally unbiased.
Yes.
So that is
So
something
as
that
you
we
rightly said, their job is to be able to recruit a patient and give a promise of pregnancy.
Yes.
Your job as a fetal medicine consultant to explain. That's how they are taking it. Procedure related risk, they think the procedure person will explain.
Yeah.
They're going to say this. The woman will say, why do you put so many embryos in the first place? Why do you have to put me through that unwanted situation? But I hope time will make things much easier for these women and they don't get exploited, because when you talk about the law, it looks so fascinating. All this is going to come into control. But in reality, it is actually going to take time, as Vivek was saying. So thank you so much for this interaction which we had now.
I have a question for Dr. Abdul. Basit.
Yeah.
Can I? Because he has an ART bank too. Well, I would like to ask, what if a child comes to your bank and says, I want to know who the donor, my donor is? What would you do? The name of the donor, I want to meet the donor.
I think I should take that question.
No,
Okay.
I
no.
think by law they can, if they're more than 18, they can know the.
No, it's not at 18. I'm just in child. See, you have records only up to 10 years. See, that's what I'll tell you what the rules are. Right now, only up to 10 years, you're supposed to keep the records. After that, it goes to the registry.
Yeah.
And then after 10 years, so when they're 18 years, they go to the registry and get that. But the point is, before 10 years, suppose a child, she, along with her parent or whoever her looking after her, comes and says, I want, or maybe her parents have died. Per se, people who are the commissioning couple have met with an accident, and she's orphan. She wants to know who her guardian is. Or
Vivek, if I can answer that question.
Sperm donor, yeah.
See, very, very clearly, when the donor is signing a consent before he gives a semen sample, he is relinquishing the rights of parenthood. That means he's strictly donating. He is in no way going to do the parental job of the child. Second thing, as a bank, the bank is expected only to get the physical details, health details, infection details, which are maintained as a record, which is given 10 years later to the National Registry. The address is confidential. The address and where this person is, this is that person's name, those kind of details will not be shared. That is on the deal on which he is donating the sample. So say Dr. Vivek Maddy himself has donated. At no point we can say, Doctor, it is Dr. Vivek Maddy. He is residing at so-and-so in Poonamali High Road. That will not be given. But fair complexion, 5 feet high. This is the infection, no hereditary disease. These kind of details alone will be given.
That is the list that we get from the donor bank saying that this is the height, this is the weight. No.
So you mean to say anonymity is maintained in our country?
Yes.
That
Yes.
a child cannot know the details about the donor.
Absolutely. Anonymity is absolutely maintained. Parental rights are relinquished.
It's not his job to take care of the child if
Yes,
in case the parents do die. No?
As it is only once they can donate, the way Vivek is going to say that once they won't donate.
They'll run off.
Now, I wanted people to understand this because they are going to get to see this situation as things go for this. Yeah.
They come to know that there are donor sample. They will be curious to know who the donor is, who is the genetic father.
Yeah, but I'll tell you one scenario. If they still want to know, they can still go to the court, and the court will decide. Is it in the interest of both parties? Is the interest of the sperm donor? Is it the interest of the child to know each other? And then it's a decision through the court that will make.
So
Not automatically through the bank. The bank is not bound to give the details.
The bank will only give
the clinic
details.
Yes.
The medical history related details, the bank is licensed to give.
But so confidentiality is maintained in our country.
Yes,
but
absolutely.
This is not true in Europe. I like to say things are changing. Maybe. It is different. And in time, it will change here also.
Maybe. As you said, if such a situation comes, as you rightly said, it may happen with more knowledge, with people knowing more, whether they are a natural child or an ART child, they may want to
they will. Because earlier the problem was like in India, we have sort of made it all right so that only one donor can give to one couple.
Yeah.
Otherwise, the problem was these children might be marrying their own sisters or brothers. So the consanguineous marriage used to take place because nobody knew who the donor was. One single donor could donate to 50 people, 100 people. So the chances of the children marrying siblings was very high. So therefore, in Europe and all, they say, yes, we don't have to maintain donor anonymity. You need to reveal who the donor is so that they don't marry their own siblings. But in India, the act is very certain. It says a donor can donate only to one couple. So you avoid that problem.
See, we also live in a country, where emotionally 99% of parents do not want to say that their child was born of someone else's gamete.
No, the question is, it's not question of parents. It's now the child marrying. See, she might after 18 years, she might fall in love with another girl or boy who's a sibling. So
no, I'm saying in the future it will become a pride for parents to say this is an ART child. But that's how the trend is going. No, the minute they may feel not offended to announce it's an ART child, and at that point the child will not want to know the genetic parents as well. So that were interesting things which we were thinking as out of the box. So I would request Dr. Abdul to move on to
session. I think we are running late, so we will move on to the next session. Next, we have our medical legal expert, Dr. Vivek Maddy, and the team of panelists, Dr. Suganya, Dr. Alamilu, Dr. Tejovati, Dr. Smita, and Dr. Priyadarshini, who are practicing ONG doctors. This will be a dialogue pertaining to the MTP Act 2022 and the day-to-day situations that we face in the clinic. And we know we will medically always be right, but let us know how to be legally right as well. So I request Dr. Vivek to take over. I think you have a presentation.
I'll just make a brief presentation so that they know what I'm talking about. Sure. So I'm going to talk about the MTP Act. And it's just a very brief summary of what this act really means and what we need to follow. And yeah, 1 minute. So we all know MTP Act. It all came about in 1971, but right now we have the amendment has taken place, and this amendment is slightly different. It makes certain changes from the 1971 Act. It all started with this Roe vs. Wade. You need to understand the history, why this act itself has come about. It all came up in 1971, the Supreme Court case Roe vs. Wade in United States, where the constitution was changed completely, and they gave the right to women to decide whom to carry, which baby to carry. The right to abort was given to a woman. Earlier, abortion was a crime in US. So this changed the whole scenario, and many countries adopted immediately this right. And India was one of the first countries. And in 1971, we had the MTP Act, an act which gave empowered women, again at that point of time itself, to decide if they want to continue the pregnancy or abort. So from 1971, we have moved forward to this amendment which took place in 2021. It gave a decision to women to decide, can they terminate? And what do you mean? Termination was allowed in only registered places. So place has to be registered, and a person who does the registration, who does the termination, should be a registered practitioner. So, and it should be an allopathic doctor. So only these two people could do a termination. These two criteria was very important. So the place should be registered, and the person who does it should be registered. If it not, it's still a crime. If either of this is not followed, it's still a crime under Indian Penal Code, and you could be imprisoned for up to 6 months to 3 years if you are not following any of these two procedures, those criteria. So, and MTP in 1971 said you could terminate up to 5 months. Now this amendment came about. This is important because it gave the right more to this woman, to the woman, to decide when to terminate. She could, from 5 months up to 6 months, it could terminate. So we should give the women the decision after 6 months, but not all women. It's certain criteria was maintained that we should allow only certain women. That is, they should, if they are minors, or if they are disabled women, or with mental, physically disabled, or where their marital status has changed, or a woman who has been raped, or a survivor of rape or of incest or rape. Any of these criteria, if they fall through, or if the fetus is anomalous fetus. So these women could take the decision to terminate the pregnancy up till 6 months. So for 5 months, it went on to 6 months. And beyond 6 months, still you can terminate anytime if it is a lethal anomaly. So you should understand this MTP Act. And it came from, as I mentioned to you, 25th of March 2021. Act has 8 sections. The important sections is section 3, 4, and 5, 3 and 4, which says who can terminate and place where it can be termination. I mentioned to you, it is a registered practitioner and place, registered place. So you need to have certain criteria, certain qualification to terminate, and also the place should have certain hygienic conditions. The salient features of this Act amendment was termination could take place up to 24 weeks to all women, even unmarried women. So that was a plus point. Even unmarried women can terminate their pregnancy. No questions asked up to 5 months. But those women, another 1 month was given as for those women who were either disabled or physically, mentally disabled, or survivors of rape or incest, or if they were minors, or if their status has changed, if marital status, suppose they become a widow, those people could also be given extra 1 month time, or if the fetus was found to be anomaly. So this, and another important feature of this act was the confidentiality clause. Was you need to maintain confidentiality of your woman who's terminating. You cannot reveal her name to anybody. Even her husband comes and asks you, has my wife terminated her pregnancy? If they are not your patient, you need not tell her, because only to a patient you need to tell the decision. So that's very important. Even parents, guardians, nobody except the patient. You are answerable only to the patient and nobody else. And if it is more than 6 months and you find the fetus is having a lethal anomaly, the only way is you have to go to a state medical board and get an approval from them saying it is safe to terminate, and they have to say it is a lethal anomaly. So you have to prove to them that this fetus is not going to survive after birth. So this woman need not carry this pregnancy up to term, and maybe we could help her, a reliever of her anxiety, so she can be terminated. Her pregnancy can be terminated. Only that condition you go ahead and terminate. Otherwise, you're not allowed to terminate. As I mentioned to you, the opinion, you need to have opinion of 2 doctors. It is between 20 weeks and 24 weeks to say it is safe to terminate and the conditions are followed. I told you about the conditions for those women who are between 20 to 24 weeks. 2 conditions for MTP, yes, if the life of the woman is at danger or if the child is having a serious physical or mental abnormality. I mentioned to you about the MTP. This has to be filled up in Form E. And what are the criteria? Please remember this: the survivors of rape or incest, minors, women with physical disabilities or mental disability, change of marital status, fetal malformation, and women in pregnancies, humanitarian settings like in COVID period. Only those people you can give them a chance to terminate between 20 to 24 weeks, and you have to fill up a form called Form E. And there's another Form D. This is which needs to be filled up for those people beyond 24 weeks, which needs a clearance from state medical board, and they have to give an answer within 72 hours of your request. That is, within 3 days of your request, they need to give an answer, yes or no, can termination take place. Confidentiality, yes, you can be punished, you could be imprisoned for more than a year if you reveal the name of a person who's got terminated. So your record keeping is very, very important. The owner of the hospital is responsible for maintenance of records, and if by mistake somebody, the nurses or somebody knows the name of the patient and reveals it to the public, the patient has a right to sue. We all have known about medical termination of pregnancy with tablets. So tablets, mifepristone and misoprostol, it's also available. You can do termination, but for those terminations, you need to still fill up the forms, Form C, Form 1, 2, and 3, and inform the authorities that you have terminated the pregnancy. Obviously, this oral tablets can be given even in a clinic, but the clinic should be attached to a registered medical center. So an MTP center, it should be registered. The clinic should be registered with them, so that if there's a complication, they can send the patient to the center. That's the reason. So, but they still have the responsibility to inform the authorities about this form maintenance. These are the basic for first trimester MTPs, basic requirements, and these are the basic requirements for second trimester, mainly the OT table and emergency drugs. These are the forms, and I mentioned to you about Form C, consent. Please take consent for every termination. It is an assault you can be charged with assault if you do not take the consent form, and you can be arrested also. So it's very important to get the consent before you do terminate, not afterwards. So that's it. I would like to complete my talk. Shall we go to questions?
Yes, you can go
Discussion.
on to the questions. Let me just share my presentation. So my presentation is visible.
Yes, go ahead.
So we have Dr. Suganya with the first question. Dr. Suganya, can you
Yes.
unmute yourself and read out the question?
Okay. Good evening, everyone. Am I audible, sir?
Yes.
Yes.
Yes. Okay. Good evening, sir. My first scenario is she is an unmarried 20-year-old female with low IQ. She was brought to the OB-GYN department with complaints of 5 months of amenorrhea. When ultrasound was done, it showed a 20 weeks pregnancy. Now, how to approach further for this
Yeah.
patient, sir?
Yeah, see, this law says married or unmarried, you can still go and do termination. So termination can be done if for anybody. So it doesn't matter if she's unmarried. So so that criteria is taken care. But second criteria is low IQ. That means maybe you have to decide is the IQ enough for her to give a consent. If you feel there's a doubt that this consent might not be a valid consent because her IQ level is so low, she's not able to understand what you tell, or she's not able to comprehend anything. Maybe she's not able to take a decision for herself that she wants to continue the pregnancy or not to continue the pregnancy, whatever it is. Then you need to take the consent of the guardian. A guardian's consent is necessary, and the guardian says, okay, termination can be done. You can go ahead with termination because it is up to 20 weeks, up to 5 months. So this law says up to 5 months, you are allowed to do termination.
Sir, she is of low IQ. Suppose if
so-
we have a suspicion that it may be caused by assault or without her consent, then we should inform the police, sir.
No, you don't have to inform the police unless there's a guardian. See, all decision for this person who has low IQ is to be taken with the guardian. If the guardian says yes, you need to inform the police. It is a case of rape. Then only if you think it's a case of rape, you need to inform the police. But if the guardian says no, I think we know who it is, and obviously this person is a known friend, and you don't have to inform. See, I told you there's something called consensual sex. If they know each other, it is a consensual sex, then it is not a rape. But if there is definitely, if you're very sure that there can't be consent in her IQ is so low, like definitely there's no consent in her side, then you have to inform the police. It all depends upon the word consent. Is this girl, it's not, you don't think about marriage as a factor. It doesn't really matter. Marriage is not the factor here. The factor is the consent. Is this consent valid? If you think her consent is not valid because she is of low IQ, that she can't decide for herself, then you need to inform the police. Police
So
is mandatory for a person with low IQ.
One more question, sir. Suppose these low IQ patients, if our attenders wants to do sterilization with it, is it allowed, sir?
That's what I'm trying to tell you. It is all depends upon the guardian. If the guardian thinks it's in the best interest of the person, then you can go ahead and do it. It doesn't mean that all low IQ people cannot be sterilized. Whoever's looking after them, if they think it is in the best interest of their child or whoever they are looking after is to be sterilized, then you can go ahead and do the sterilization. It all depends on the guardian. Guardian's consent. Guardian puts herself into the foot of the patient, the shoes of the patient, and decides.
Okay, sir. Thank you, sir.
So, sir, this guardian should be sort of a
Legal guardian. You need to have You need to have a legal guardian. That's what I'm trying to say. It is a court should decide who the guardian is,
legal.
not anybody on the road.
Yeah.
It's anybody who's of mentally challenged person. Okay, I would say that mentally challenged is the word which we are rightly to use, not even low IQ. So, mentally challenged person, they need to have a guardian's thing from the court. Court decides who's the guardian is. They are responsible for this person, and they take all decisions for this person.
Okay. So, Dr. Alamelu, can you? Dr. Alamelu, can you ask
Yes,
the question, please? Yeah.
Yes, sir. Yes, sir. Have a very good evening to all.
Yeah.
A 20-year-old pregnant lady with 11 weeks of gestation, and she has lost her husband in an accident recently. Now, as a major, she wants a termination of the pregnancy, but her in-laws are denying for termination. So, what could be the legal issue in this case, sir?
No. Again, see here, what is this MTP Act? The substance of the MTP Act. What the law wants to empower women. I told you, this is an empowering act. So it decides. It is for the woman to decide if she wants to carry the pregnancy or not. It's her decision, not anybody else's decision. If she wants to terminate, she doesn't need to take even her husband's consent. She can terminate without even husband's consent. Forget in-laws. Here, even if her husband is alive, she can terminate the pregnancy.
Yes,
So,
sir.
let me ask this question, Dr. Vivek. What if our in-laws come and create, say you're a private practitioner, you're trying to facilitate.
Yeah.
Say bring a whole lot of 10, 15 relatives and they create ruckus.
Call the police. Call the police. The police has to handle the situation. Nothing, because law protects the woman. So if a lot of people are coming, so law protects even doctors. So nobody can come into your clinic and cause ruckus. If somebody is doing that, all you have to do is call the police. They will just push these people out.
Hopefully. Yeah, okay.
Yeah, that's the law. The law protects hospitals, doctors, and people who are on the right side of the law. Here, this 20-year-old woman is on the right side of the law. She needs to be protected. She wants termination. Termination can be done.
Yes, sir. Thank you, sir.
And it's the other way around also. If she wants to continue the pregnancy and her in-laws want to terminate, no, she wants to continue. She can continue.
So suppose we are planning surgical evacuation for this patient, sir.
Yeah.
Then the witness consent is important for that, no, sir? Along with her consent.
No, only her consent. Why you need a witness consent?
For any procedure we are carrying out, the patient consent.
Only patient consent. That's why I told you, there's a doctor-patient relationship. You are bound to a patient. The doctor is bound to a patient. Whatever the patient says, you are supposed to listen and do, because there's a contract. As soon as the patient comes to see you, there's a contract, and not with anybody else. You're taking money only from the patient, not from anybody else.
Okay, sir.
Dr. Tejavati?
Yeah, sir. Good evening, sir. This is what is seen in regular practice. A 17-year-old married girl who presents to OPD with 16 weeks of pregnancy with her parents. So now should we consider that marriage as legal, or should we report to police because she's a minor, and can we terminate the pregnancy for a 17-year-old girl?
Yeah, see, first I'll tell you one thing. There's something called a POCSO law. A POCSO says less than 18 years, a minor cannot even be pregnant. Okay. Now, if she is pregnant below 18 years, if she's married or unmarried, that's not the point. She cannot have a sexual contact less than 18 years. It is an offense. So if you, as a doctor, we are all supposed to be aware of the POCSO law. And according to the POCSO law, anybody who's pregnant, who's a minor, we are bound to inform the police. That is section 19 says. It is our duty to inform the police. Now, in this case, you just take out, you don't have to worry about she's married or she's minor, you're supposed to inform. So you inform. Now, there's something called, recently, there's a ruling that is come up in the Supreme Court for, especially because many of these girls are married less than, when they were married, and they get pregnant and they are less than 18 years. Especially in Muslims, they get married as soon as they attain puberty. So the law says also, right now we don't have a common law to encompass all the religions. So we are supposed to respect the customs of the Muslims. So for them, marriage is allowed even at 16 years of age. So now the court has said, if it is a Muslim marriage and it's less than 16, woman is still 16, it's all right, provided if they are ready to agree to termination. If they are agreed to terminate the pregnancy, because there's something called MTP law. The MTP means confidentiality is maintained. I told you, you're not supposed to tell you're terminating a woman's pregnancy. So the MTP Act comes above the POCSO Act in India because of these situations. So in India, the MTP law says you need to maintain the confidentiality of the woman. So if a 17-year-old girl, minor, wants to terminate the pregnancy, then you don't have to inform the police. Okay. And if it is, and if the guardian, or see, again I said, for a 17-year-old, first is the guardian. You need to get the consent of the guardian. Nothing to do with anybody. So the guardian says, yes, you go ahead and terminate, and I don't want you to inform the police because I want my child to be safe. I don't want her to get a bad name. So therefore, you terminate. I don't want this case to be taken up by the police. We will deal with the situation, right? You can accept that because this has come a ruling, especially for India, because we have different cultures, we have a different religions. So we have to respect religion. Religion is one of the most important things that is ruling us. So we follow religion more than the law many times. So
Dr. Vivek, until now it was thought like if it's a teenage pregnancy, we have to inform on grounds of POSCO.
Yeah, but recently MTP Act is given more prominence than the POCSO Act. MTP Act says you should not tell anybody who you're terminating. The confidentiality clause. I mentioned.
If the girl comes to the legal guardian and the legal guardian assures, like, we don't want to inform the police, we don't want.
Yes.
That means we can go ahead and facilitate the service.
Yes. But if they say, I don't want to terminate the pregnancy, then you're bound to. POCSO Act will come into place. The POCSO Act says you're bound to inform the police.
Okay. So
only if you're terminating.
Can overrule the POSCO Act
of
confidentiality.
Yeah, MTP Act overrules POSCO Act.
That a 17-year-old girl cannot have sex. I think now we have gone to the point that sex, the doctors or parents hardly have a hold on that. The stronger word is they cannot carry a pregnancy forward in teenage.
No, right? Even sex. Please understand, even sex, even contraceptive tablets, we are not supposed to write.
How can that be?
Yes.
In that case,
16-year-olds, the law POCSO Act says that any girl less than 18 years, if you are aware that she's having sexual intercourse, you're supposed to inform the police. So if a woman is coming and telling, I want to have contraceptive pills,
we can't prescribe contraceptive pills.
You cannot allow her to break the law.
Okay. So any comments from the other doctors who are taking part as panelists? How far you are able to handle teenage pregnancy in the grounds on which Dr. Vivek was guiding for the law? Any comments?
Sir, when a teenage pregnancy comes, we should inform the Child Welfare Committee, no, sir?
See, that's what I'm telling you, that is if she wants to continue the pregnancy, If she's minor, you have to inform the child welfare committee or the guardians who will act in her behalf. Child welfare committee is like a guardian committee. So they take all decisions for her, like in case something happens for consent and any problems to her, they will look after. But more important is police. The police is supposed to catch the culprit, because by law, nobody less than 18 years can have sex. So if she's pregnant, then obviously there's some evidence that she's had sex. Pregnancy is an evidence. So definitely the culprit will be caught. So it's the duty of the police to catch the person who's responsible for her pregnancy and imprison him. For that, we as doctors, we only have to inform the police.
So, for informing the police, we should follow any kind of format, sir. We have to give a
Local police, nearest police station, you just give a complaint, a written complaint, and get an affidavit, or I mean, you get a written signature from them that you have given a complaint. That's all. That will be as a document. You have given the complaint. Tomorrow, you should not say you have not given the complaint. You have not given the complaint. It's your duty to give complaint. Because if you don't give a complaint, you can be imprisoned for 6 months.
Yes. But if the attenders are not willing, we have to counsel the attenders before giving the.
No. Here the law comes before the attenders. Okay. We are nothing to do with the attenders. But the funny thing is, if the attenders, not in attenders, the guardian says, I want to terminate the pregnancy, then you can't even inform the police. Or you can terminate the pregnancy and tell the police you have terminated somebody's pregnancy, a teenage pregnancy, but you're not going to reveal the name. It's for them to follow up once they get a complaint. They can't do anything unless, even police can't do anything unless there's a complaint filed with them. A police can take action only when they have a complaint.
One more clarification, even if we consider the religious grounds here, yes, because she is a minor, the person who is giving the consent are the parents, right?
Yes, minor.
Not the husband.
There's no husband here. Oh, you mean to say married? Yeah, okay.
Yeah,
it is a parents.
Also.
Yes.
Then
parents.
It is always the parents, not the husband.
Yes, no, but in Muslim law, they are married at 16 years. Marriage is allowed. That's the point. You need to know the.
So then husband becomes the legal guardian.
Legal guardian.
Okay.
Only for Muslims. If you're Hindu marriage, you have to be 18 years to be married. So you're not married up to 18 years. So in that case, the guardian will take for a Hindu girl, guardian will be the father or the mother.
So what if the family wants to continue the pregnancy and the girl also says she wants to continue the pregnancy? Where should she go, or should
no? That's what I'm telling you. If she's a minor and she wants to continue the pregnancy, you have to tell the police. And once you tell the police, you can terminate the pregnancy with the consent of the guardian, because it has not. You as a doctor, you're supposed to only give service. For the service, if she wants termination, you're supposed to terminate. That's what the MTP Act says. You can terminate by taking the guardian's signature. MTP Act doesn't say you cannot terminate minors. No, you can terminate the pregnancy of minor also, provided you get consent from guardian. That's what I want everybody to understand. Everybody, when you suddenly see minors, you say you don't want to terminate. No, please. That's not right. Even a minor needs help. More help she needs. Her pregnancy needs to be terminated if she wants to terminate it.
Can be carried on in a private setup, sir.
Yes, any setup. We as doctors, we are supposed to empower our women, give them all guidance. So you terminate it, but very important, consent has to be taken. Now in India, minors are 18 years, but if you say abroad, it is 16 years there. So a consent there, you need to take signature of a 16-year-old and the guardian. Here, up till 18 years in India, they have no say. But abroad, they say there's something called in UK Fraser's guidelines. 16 years can decide what to do, but you still need to take a guardian's signature after taking the child, 17-year-old girl's consent. The consent of a girl is very important. 17 years is supposed to be a mature adult. In India, you're not. So let's talk about India. In India, minor is 17 years.
Okay, we'll go on to the next question, Dr. Smita.
Good evening, everybody. Actually, sir, after your presentation, most of the doubts have evaporated. Still, I'll just go ahead with the question. 16-year-old girl eloped with her boyfriend and became pregnant. Her parents have brought her back home, and she is now 16 weeks of gestation. Parents are opting for termination of pregnancy, but the patient, wants to continue the pregnancy. Now, how do we continue with this?
I've already mentioned to you, no, sir, she's a minor. Well, she wants to continue her pregnancy, but a minor cannot give consent. A consent only can be given by her parents, a guardian. A guardian takes a decision. In India, 16-year-olds doesn't have any say. They don't have any say. So she wants to continue or not. It's not for her to decide. It is for her parents to decide. Now, her parents can say they want to terminate it. Okay. Now, the second thing that comes here is if the parent says, don't give complaint to the police, we know her who's responsible, the boyfriend, then you can terminate the pregnancy, don't inform the police. But if they say, no, I don't like that fellow who is responsible for this pregnancy, I want that boyfriend to be imprisoned, then you have to tell the police.
So I have a question here. What if this is consensual sex?
No, there's minors cannot give consent.
No.
That's what I'm trying to say.
Yeah, not consent, but the law comes into effect only for the boyfriend, not for the woman who had sex, for the girl who had sex, is it?
Yes, the law is protecting the girl. Nothing to do with the boy. We are not bothered if the boy is 16 years or 18 years or 20 years or whatever. It is here, we are here to see the girl. She is a minor. She cannot give consent, and her body has been abused. So therefore, she's become pregnant. So she needs justice. So there's no consent. It might be her boyfriend, somebody she loves. No, she cannot give consent, but her parents can give consent. If a parent says, don't, we know the boy who's responsible, we let us forgive that boy, they're going to get married later, don't tell the police, you're not bound to tell the police.
Now, most of us know that most of the population we handle are quite fickle-minded. So they may say that today they are okay with not giving a complaint, and tomorrow say that we had come in for consultation.
No.
Do we
That's why
written consent saying that you do
Yes.
not want MLC or you don't want it the case registered?
Yes, once you get that signature, you're safe. That's all. I'm here to talk to you about how doctors should be safe. I'm not talking about anything else. I'm just trying to tell you how doctors should take precautions to ensure they are having safe practice. So the first thing is, yes, you have to talk to the guardian, find out what they want. Nothing to do with the girl. If they want termination of pregnancy, yes, you can as doctor terminate. Second is, don't inform the police. If they want to terminate the pregnancy and they want to inform the police, you have to inform the police and take the sample in saline water, saline fluid, and give it to the conception in saline fluid and give it to the police. It is like an evidence. They will send to the forensic department and confirm the DNA and confirm with the boy's DNA later and match it, and he will be put in prison. That's how it's a part of evidence collection, and we need to help that woman get justice, the girl. Because as doctors, our duty is to collect evidence. Remember that. First is, if it is a medical legal case, our duty is to collect evidence. And evidence is conception. The conception, we need to collect it in saline water and send it to the police.
Okay,
Thank
we'll
you,
move
sir.
on to the next question. Priyadarshini.
Good evening, sir. My question is like a 20-year-old with irregular cycle, she got to know that she's pregnant with 26 weeks of gestation, and scan done at that time shows multiple anomaly, and she's opting for a termination right now. So what will be the legal issue? And also,
Yeah.
like if the multiple anomalies are non-lethal anomalies,
Yeah.
then how do we deal with that?
Yeah. So if it is 20 weeks, 26 weeks, first is, and if you find it as lethal anomaly, then you can go to medical board. There should be a medical board and get the consent from the medical board saying it is a lethal anomaly. The fetus will not survive later. So you're going to help this woman terminate the pregnancy immediately. So you should prove to them that it is, you're going to safely terminate. You're responsible. You're taking all responsibility to terminate it, and you need to take 2 doctors to give that opinion. Yes, this can be terminated. Once the board approves it, it says lethal, then you can terminate. Well, second case is if it is at 22 weeks and it is non-lethal, yes, you can terminate. Don't need anybody's permission. Up till 24 weeks, non-lethal anomalous fetus, you can terminate. No questions asked. Nobody, just 2 doctors have to approve that it is safe and it is non-lethal.
Okay.
Anomalous.
But even if 26 weeks and
Yeah.
if it is again the same scenario of multiple anomalies, non-lethal, can I still go to medical board asking?
No. If it's non-lethal, you have to convince her to continue with the pregnancy. And after pregnancy, do whatever surgery they want to do and continue having the child. They cannot, the fetus gets the right to live. After
Okay.
24 weeks, the country gives the power to the fetus to recognize itself as a citizen of this country. And if you kill, that means beyond 24 weeks, you're murdering a person. And therefore you will be held responsible. It is murder.
Okay.
Child gets right.
Okay.
Next.
Hello.
Yes.
Yeah. Is the screen visible? This was the other version of the same
Same thing.
question.
Yeah, it was the same thing.
So this is also, this is a new scenario. Dr. Suganya, you can go ahead.
She's a 17-year-old student. She became pregnant with a boyfriend. Now she is 12 weeks of gestation, wants termination of pregnancy. She came to the OPD without any attender. Can we go ahead with termination without attender, sir? Will that be any legal?
No. Yeah, she's a minor first. A minor needs to have a guardian first. First, her boyfriend is not a guardian. Her minor needs to have a guardian. A guardian is her parents. So you should inform first you have to inform the police. This becomes a police case because she's a minor who's pregnant. Police has to be informed. Guardian has to come. If the guardian says terminate, you can terminate the pregnancy. But in this case, again, before you inform the police, inform the guardian. The guardian says, yes, don't inform the police, then you don't need to inform the police. It's all depends upon the guardian.
Okay.
That's why I told you, for minors, guardians are very, very important. The guardians take decisions for the girl.
Suppose she's 24 years and in a consensual relationship, she comes alone for termination, sir. We should proceed with that.
Yes. If she's an adult, you
That's
can go
not
ahead.
the issue.
But still, in that consensual, you get in writing that it is consensual. Because tomorrow she falls out with the boyfriend, and they come and tell you that you have not given a complaint to the police. That means you are hand in glove with the boyfriend, and you can also be brought in as a accomplice for the rape. So therefore, it is always better in the interest of unmarried girls to get in writing that get a guardian. I mean, to get in writing that it is consensual sex. Pregnancy has been through consensual.
Suppose she's needing any procedures like check curettage also.
Yes.
Her sign is enough. Sir.
Yes.
Or we should get that.
No. If Securitas is, if she's already pregnancy has been terminated, you don't need anybody's signature, only hers. No, here if she's a minor, then if you want to touch her, you still need to have a guardian. A minor cannot give consent. Remember that. A minor cannot for any procedure. A
No, sir,
minor
24
cannot.
years, sir. 24 years.
24 years, yes. So you don't need anybody's signature. Her, she's a woman. She decides what medical treatment she wants, and you
Okay.
can take her signature.
Okay, sir. So we have to get RCH ID for these cases, sir, unmarried pregnancies.
Yeah, you have to inform the government for every pregnancy. They want to know, married or unmarried, they still want to know every pregnancy what has happened.
Okay, sir. For all terminations, then we should get the
You have to,
RCH.
yes. You need to get that number. So don't be in a hurry to terminate. Need to go through procedures, get everything done and terminate.
Okay, sir.
Dr. Alamilu?
Yes, a 15-year-old girl was raped by her own uncle. Now she is 32 weeks of gestation. If she delivers in our hospital, do we need to report to police?
Yes,
and whom
yes.
to hand over the baby, and what are the legal issues?
Yeah, you need to inform the police first. Okay, there's no way that her own uncle has the right to do this to her. So you need to inform the police, and then guardian. The guardians will look after. They have to hand over the baby to the guardian. If the guard, see, most of the time what happens in our country, guardians refuse to take the baby. That's very sad. And that's where the child welfare committee comes into place. They give the child for adoption. That's what is happening. This is what is happening in our country, which is very sad. It should not happen. But when somebody abandons the child, then that's the only way out. They have to be given to adoption centers where children are given for adoption to foreign agencies. That's what's happening right now. Very sad situation. This is reality that's happening.
That's true. So we have to inform the guardians, and we have to hand over the baby to the guardians. And if at all they are not willing, we have to hand over to the child welfare society.
Yes.
And we have informed the police, and we can conduct the delivery at our place. It is not it will not give any problem. Yes. Okay, sir. Thank you.
Dr. Tejavati?
Yes, sir. So my next question is, the MTP has been initiated elsewhere, because this we see quite often, because it would have been prescribed in other clinics and all. Patient will come with incomplete abortion. So still, should we fill the forms and do the proceedings, all the things?
Now, let me tell you what MTP stands for, medical termination of pregnancy. That means it was a live child, live fetus inside, and you have terminated it. So when you see there's no life, then you're not done termination, but you're doing a medical emergency. You're helping her with a medical emergency. So in that case, you don't need to fill up any MTP forms. MTP form is only specifically for a live fetus.
Okay, sir. What about when they take pills over the counter?
That's not your responsibility. If they are not supposed to give. It is the pharmaceutical fellows who will be caught if there's a complication. You can tell the police that if they get into trouble, like a negligence case, then the pharmacy gets into trouble. They'll have to pay for the negligence.
Okay.
OTC should be informed, sir. Any specific?
No, you don't need to inform. You are only treating as emergency. You're not duty bound to inform anybody, because you're not seeing a live fetus. It is already gone. You're only trying to help this one emergency, medical emergency. But the question is different if it is a minor. If you find this in a minor, then you are bound to inform the police, because this type of medical emergency happens in a minor, then it cannot naturally happen, no? So if it's a major who's taking MTP tablets, she's taking the risk on her own. So if there is any problem, then it becomes only a negligent act, not if she's not breaking the law. But if a minor takes any of these tablets and gets into trouble, then you have to inform the police to find out who's given the tablets, who's dealt with this problem, how did the minor get to know what tablets to take. All that investigation police will do and catch the culprits. But you as doctors, we as doctors, we need to do our work with the consent of the guardian for a minor. Whatever health care they're giving, it has to be done with the consent of the guardian. That's all I want to mention.
We'll move
So
on to
for missed abortion and embryonic gestation, we doesn't want to fill the forms and also.
Yeah, not necessary. It's not a live pregnancy.
Then we should include it in the admission register, sir. Like we are terminating.
Bleeding. She just came for health, for bleeding. She came with bleeding. That's it. You are just giving her medical help.
Okay, sir.
Medical care. That's all.
But we should get the consent for MMA, no, sir. That,
yes. You have to. Yes. No. Why you have to get consent? You are not responsible for giving those tablets.
No, for missed abortion like that, and we are giving, no, sir, for termination.
Yeah, but for that is a medical treatment. It is not to do with termination. So it's
okay.
You need not inform the thing. It's you're giving MTP pills as a treatment. It is a treatment and not a termination.
Okay, sir. Thank you.
I think this question has been covered, so we'll move on to the next question. Dr. Priyadarshini.
So then my next question is, it is basically a general question. As destitute was found seizuring on the road and was brought to a hospital by the people who are around her, and per abdomen is corresponding to 28 weeks. BP is 190, 110, and urine albumin is 4+, and there are no relatives, and her GC is 715. So in that case, who gives consent and how do we approach that?
Now, what is the age?
Age?
She's an adult?
She's an adult.
Yeah, so you're adult who's pregnant and who's fallen on the road. You need to help her. We are as doctors, we need to give her medical treatment. Doesn't need anybody as thing. You can go ahead and treat her, and if at all responsibility is taken up by the head of the institution. Whoever is the head, who's the admin, who's the admin in your hospital, just inform them and go ahead and treat her. They give the consent.
So actually, no need like that is brought in. There is no, we don't know the age. We will never know the age. There will never be a guardian.
Yes, but so what? But first thing is, we are bound by the law to give help to any human being. As doctors, first thing is we are doctors. We are have to give. She needs emergency treatment. You don't worry about anything. You don't in emergency treatment. You don't need consent. You can go even operate, even operation done in the best interest to save the life of a child, of a person, doesn't need consent.
So the gynecologist,
yes, we do even hysterectomy in case of deliveries. Why? How do we do that? Because you don't take consent. Even then, you are protected by the law because you're doing to save the life of the woman. Any help to save the life of a woman, you don't need consent.
Sir, in this case, like we have to terminate the pregnancy. In that, is it legal for us to go without a consent?
Without consent, yes, you can. There's in MTP Act there is a section 8. Anything what you do in the best interest of the patient, you're not liable. You're doing in good faith. You have no malice, nothing. You're doing everything in good faith to save the life of the woman. You don't need any consent. You can go ahead and give any type of treatment to save the life.
Is it single gynecologist who can make a decision, or you need or you need MSS permission?
No, nothing. Any doctor can, any doctor, even on the road, if you want to resuscitate anybody, you can do it. The best interest. That's why we are doctors. We can give consent in the best interest of patients. We are protected.
Okay. I think this is the last question.
Yeah. So it's a heart
This is-
disease. 17-year-old with a heart
Yes.
disease.
And she's 17 weeks pregnant.
Yeah. So she's in an orphanage. She, first of all, she's a minor. So orphanage, somebody in the orphanage should give the consent. You can go ahead and take that person's consent, but then she's a minor, you have to inform the police. How did that person ever become pregnant? So police will take action. But you as doctors, take the consent of the guardian, terminate. Obviously, to save the life of the girl, with Heisenberg syndrome, she can't continue the pregnancy. Her life is at risk. So you can go ahead and terminate. But inform the police. They have no right for a 17-year-old to become pregnant.
In this patient, the initially the termination itself, they have given consent. If any added procedure required, you will take an additional consent from the same person from the orphanage, or can the gynecologist make a, because obviously they won't be there all the time.
No. See, anything with a girl with a heart problem, like a hole in the heart, you are going to do in the best interest to save the life. So
Medical emergency.
Medical emergency. So you don't need any signature from anybody. You can still go ahead and terminate. For best interest, you're taking the guardian's signature. That's it. But to save the life of a minor, you can still go ahead. In this case, terminate the pregnancy. But important thing is to inform the police.
Just one curiosity that you said that all the pregnancies have to be informed, right? It's only intrauterine pregnancy or tubal pregnancies as well.
Yeah, any pregnancy vice versa. It doesn't matter if it is intrauterine, extrauterine. Pregnancy as such, MTP comes into place.
So even if it be a laparotomy or laparoscopy for ectopic, or
Yeah.
it be a spontaneous resolving pregnancy, all
Yeah,
that.
but if it is alive,
Oh, only.
but let me tell you, if it is extrauterine, I think we don't need to inform the NTP Act. But the law says in the if it is a minor, you need to inform the police. All that is there.
Yeah, that's
But
spontaneous.
then, that is there. But the NTP Act would not. It is only for live pregnancies. It is intrauterine.
Okay.
Extrauterine, which is not. You're doing it as a
Becomes a
medical emergency.
or
Emergency, yes.
emergency.
Surgical. You're doing it to save the life of the woman. Then it is all right. You don't need to.
Does that need to have an RCH number? No.
No. That again, it is not pregnancy.
Yeah,
You're only informing. See, government.
Right.
Why all this has come about is because of female infanticide. It's a large problem in India. So that's why the MTP Act has made it so mandatory for us to inform them, because otherwise infanticide will go unchecked.
Right.
So therefore, all live pregnancies which are being terminated, we are supposed to inform the government. Yes, this is the decision of the people. People want to have it terminated. And, they have a fundamental right to terminate. And they do not know the sex of the baby, so they have the right to terminate.
She's coming at early, sir, very early, 5 to 6 weeks. That also we should inform before giving medications.
5 to 6 weeks is not a live pregnancy, it's not.
So it's not necessary to inform. Okay. So suppose a person is with sterilization failure.
Yeah.
With irregular cycle, she's coming at recognizing a pregnancy only at 22 weeks. She wants to terminate. We can go with that.
22 weeks, yes, you can terminate, because one thing, you're still giving the woman one reason why she can is giving her mental problem, like mental agony is a clause for termination. So if her physical disability or mental disability is going to cause her a lot of agony, you can terminate. Up to 24 weeks is allowed.
If above 24 weeks, go through medical.
Yeah, that's why I told you, between 20 to 24 weeks is anything that can cause physical or mental problems. So these women can terminate.
Sir, about mentioning one more thing, sir. because as you mentioned, the female infanticide, supposing if a lady comes with the 2 female children, she already has 2 female children. Now she comes at 20 weeks of gestation for termination to our place. And we suspect that could be a female sex determination done somewhere else. Should we continue the termination of pregnancy, or should we go for any other?
No, see, as far as you can maintain that you do not know the sex of the fetus and is there right to terminate, you can terminate. But if you think that you know it is a female baby, then you cannot terminate. But you should think consciously. You should say, I do not know the sex of the fetus.
Yes.
If they have found out, that's their problem.
Yes.
But you're not involved in their determination of sex. So you should be clean. Your hands should be clean. Woman wants termination up to 5 months, you're allowed to do.
Should we inform this to our district health officials that this has been that she has come for? That could be a suspicion.
No. Suspicion. Once you say suspicion, then you're involved.
Okay.
Don't ever tell you're suspecting. Why you should suspect? You cannot be held. You should go with a clean hand. Yes, I do not know anything. Why their reason they want to take the risk of terminating. You should be clean. That's all.
Either you do it or you send the patient.
Yeah, that's it. But you should be very clear that you do not know the sex. Minute you know the sex, you can't do it.
Yes.
So I think we have come to the end of the discussion. Thank you, sir.
Yeah.
And thank you all the wonderful panelists for a very nice discussion. It was very eye-opening and, very practical as to what we need to do in everyday clinic. So we'll close the program for today. Thank you, Dr. Rajapriya. She's not able to join us because her internet has failed. So she wanted me to convey her sincere thanks to the Vellore as well as the Tiruvannamalai OG Society and all the panelists as well as Dr. Vivek for a wonderful session, and Emcure as well for hosting the webinar. Thank you, everyone. Thank you.
Thank you, sir.
Hello.